It is normal to panic once you notice symptoms that could be possibly linked to that of the pandemic COVID-19. The first thought will be to rush to the hospital for a checkup. However, Deputy Director General of the Ghana Health Service, Dr. Anthony Ofosu, is advising the general public that once you notice these symptoms, call the emergency number 112 for help rather than rush to the hospital. In an interview with JoyNews during a donation made by the National Association of Registered Midwives, he said this is crucial to prevent the health workers or the health centers from being swamped with cases.
The other thing that also we talk about that is also critical is that we need to protect our health facilities. What I mean is that the instruction is that if you have any of the symptoms that we've mentioned, if you have a fever, you have a cough, you have a sore throat, you have bodily pains, or you've been in contact with somebody from outside, don't go to the health facility. Stay at home and call the number 112 and you'll be helped. You'll get help to you. If you go to the health facility, you compromise the whole health facility, including the staff. So that sometimes the staff who come into contact with such patients need to be self-quarantined for 14 days. And that means that health workers are not available. Sometimes we have to close down a whole unit, like we did for the emergency room in Rich Hospital. And you know that there are other conditions that people get even during this time that needs care. So that if we compromise the health facilities, then we are reducing access. So let's stick to the health education messages that we are given, that when you feel sick, don't move to the health facility with symptoms that are similar to what we've been talking about as COVID. Stay at home and call 112, and then we'll get to you and support you.
Now, President of the National Association of Registered Midwives, Hajia Widwana Hawa Amakweje, expresses concern over the challenges that midwives across the country face in performing their duties and practicing social distancing at the same time. She appealed to government to put measures in place to make it easy for midwives while they're on duty.
On the whole, it consists of 2,550 pieces of hand sanitizers, and then 2,550 pieces of antiseptics, which they call Dettol, then 2,550 pieces of Rozone, which is Parazone, then 2,550 pieces of liquid detergent, which they can use to manage at least whatever small way it could. We know the system we have in Ghana here doesn't encourage this distance, social distance. Yeah, when you go to the antenatal clinics, it is crowded. The postnatal clinics, it is crowded. Patients continue to come in from the communities to see our midwives. Initially, we were practicing the focused antenatal, which is one-on-one with your patient. Now the patient comes in, can she sit directly before you? It's all frightening. Yesterday, we met the Honorable Minister of Health, and I've reported this issue to him, that our system in Ghana doesn't permit the social distance. Patients will come and we are crowded on the bench. If it's 5 on the bench, 6 on the bench, where do the others stand? They haven't provided extra chairs or furniture for us, for them to sit. So it is the crowding system which we are still working, midwives are working in. And he said they are going to look into it and then action will be taken.